Laryngotracheobronchitis aka Croup. The majority of symptoms in this condition arise from a recent encounter with the parainfluenza virus, responsible for 3/4 of cases. However, other culprits include the rhinovirus and the respiratory syncytial virus. This condition predominantly targets infants between the ages of 3 months and 6 years, impacting up to 6% of youngsters. It's most prevalent in children aged 1 to 2 years, with males being more susceptible than females. The onset of symptoms is more frequent during the colder seasons and typically manifests during nighttime. The cough is intense, often resembling the bark of a seal. In the intervals between coughing fits, the child might experience shortness of breath. While symptoms usually alleviate during daylight, they tend to resurface at night. Most children recover within 2 days. The approach to croup hinges on gauging its intensity. Parents should seek medical attention if symptoms linger past 2 days or if signs of breathing difficulties emerge. The go-to medical response for children displaying stridor involves administering oral or intramuscular dexamethasone or nebulized budesonide. Asthma. The estimated prevalence of asthma in adults is around 4%, but could be as high as 10%. For children, the numbers are greater, ranging between 10 to 15%, with some children outgrowing the symptoms by adulthood. Asthma manifests as a persistent inflammation of the airways, leading to symptoms like coughing, wheezing, a feeling of chest constriction, and difficulty breathing. These symptoms are often inconsistent, sporadic, more pronounced at night, and can be exacerbated by specific triggers. Other potential indicators include a personal or familial history of allergic reactions and aggravated symptoms after consuming NSAIDs or beta blockers. Chronic obstructive pulmonary disease. Chronic bronchitis and emphysema are both conditions marked by lung tissue damage, and together they fall under the umbrella term of chronic obstructive pulmonary disease or COPD. The exact number of COPD cases in the UK is not clear-cut. Yet, data suggests that around 1 million people are diagnosed with COPD, leading to 25,000 fatalities annually. Individuals with chronic bronchitis typically have a history of recurrent bouts of acute bronchitis. Over time, these episodes intensify and last longer, eventually resulting in a constant cough. Chronic bronchitis is characterized by coughing and producing sputum for a majority of days across 3 consecutive months for 2 successive years. The primary culprit behind chronic bronchitis is the prolonged inhalation of irritants, with tobacco smoke being the most significant. Smoking history stands out as the primary factor in chronic bronchitis development. For those who don't smoke, the probable causes are upper airway cough syndrome, asthma, or acid reflux. Research indicates that 99% of non-smoking chronic bronchitis patients with standard chest X-rays are affected by one of these 3 conditions. Chronic bronchitis initially manifests as a dry cough, which later evolves into a cough producing thick mucus. It's crucial to look into smoking habits. For smokers, the cough is typically more pronounced in the mornings. Secondary infections often lead to the worsening of chronic bronchitis symptoms. This condition is more prevalent in individuals over 40, especially men. Community-acquired pneumonia. Annually, community-acquired pneumonia affects roughly 0.5% to 1% of the UK's adult population. The primary cause of pneumonia is bacterial infection, with Streptococcus pneumoniae being the leading culprit in about 80% of cases. However, other pathogens like chlamydia and mycoplasma can also be responsible. In the first 24 to 48 hours, the cough is dry and painful. It soon evolves, producing sputum which may have a reddish hue, with the shade of red differing based on the infecting organism. The cough is often more severe during nighttime. Affected individuals might feel quite ill, exhibiting symptoms like high fever, headaches, and difficulty breathing. They might also experience sharp pain on the sides due to the inflammation of the pleural membranes, which intensifies during inhalation. Immediate testing to determine the necessity for antibiotic treatment is essential. Medicine-induced cough. Certain medications can lead to cough or wheezing. Among these, angiotensin-converting enzyme, ACE, inhibitors are most frequently linked to coughing, with the occurrence rate reaching nearly 20%. This reaction isn't tied to the dosage and can emerge anywhere from a few hours to over a year after beginning the medication. Once the ACE inhibitor is discontinued, the cough typically stops, though it might take 3 to 4 weeks to fully subside. Other drugs that might induce coughing or wheezing include NSAIDs and beta blockers. In such instances, it is important to consider alternatives, such as angiotensin II receptor blockers, which have only half the likelihood of causing a cough as compared to ACE inhibitors. We really hope you enjoyed our video and found it informative. Please kindly give us a thumbs up, share and subscribe for more content. Please give us your suggestions for future topics in the comments section.